Congressman Dr. Price joins us live. Nice to see you, sir.
Great to be with you, Greta. Thank you.
All right, this bill that the Republicans have proposed, will it cover, how many people will it cover? You have any idea?
Well, what it does is address the cost issue, and we believe that if you bring down costs significantly, then you can increase the number of folks that are covered. We also increase competition so that you also bring down costs, and we allow for folks to pool together with the purchasing power of millions so that you cover those folks with pre-existing illnesses or injuries. Those are the things that the American people care about. As a
practicing doctor, when you were practicing doctor, what were the problems you had? I mean, that we sort of need to remedy with this?
Well, pre-existing, I mentioned, you ought not lose your insurance if you change your job or you lose your job. That's the portability issue.
Is that fixed in your bill, in the Republican bill?
We believe it is by decreasing the costs and also the pooling mechanism, so that if you have an awful diagnosis or an injury that you don't that runs up the costs, that you don't get priced out of the market, being thrown into the individual market, get priced out. So we pool folks together to be able to get that purchasing power of millions, and then the incredible burden of malpractice, the incredible burden of liability, so that the lawsuit abuse that occurs, it runs up the cost of defensive medicine, and then you have hundreds of billions of dollars. We address that. The Democrats don't.
All right, now let me talk about the malpractice for 1 second, because a lot of these malpractice proposals are batted around. They never talk about capping the legal fees on both sets of lawyers, the ones who are suing and the ones who are doing the hourly rate. Does your proposal at least put a cap on both so that they both have an equal incentive to try to sit down and resolve things?
Well, any of those caps address the issue of non-economic damages. So the folks that
but that's the person who's hurt. I mean, the persons who are driving this are the lawyers.
They are.
And if you want the lawyers to sit down and figure out, because there are some legitimate legitimate malpractice, and there's some illegitimate ones. But if you let the lawyers, run amok, they're going to keep fighting.
Yeah, but it's not the hourly rate that's the problem. It's the tens of millions of dollars that occur with the non-economic damages.
But see, it is. If you've got a lawyer who's getting paid by the hour, he has no incentive, or she has no incentive to sit down.
I'm defending the lawyers.
I know, you're defending the lawyers. But you've got to. If you've got someone keeps getting paid by the hour, the person has no incentive to sit down and do the right thing.
That drags out.
And brings 15 lawyers to a deposition and bills the lawyers, bills the insurance companies. You've got to stop that.
Absolutely. And you can do that through other kinds of mechanisms, like arbitration, like health courts, which we proposed in other pieces of legislation.
But even arbitration adds a whole other layer where lawyers are getting paid by the hour. You've got to stop the lawyers and force them to sit down and talk reasonably.
What our bill does is begin the process in that direction. What the other side's bill, what the Democrats' bill, what Speaker Pelosi's bill doesn't do is anything as it relates to
they don't even mention it.
Malpractice.
They don't touch it. The Democratic bill doesn't, right?
They've got some pilot programs and some grants. They want to study the issue. The fact of the matter is we don't need to study the issue anymore.
I'm with you on that. I can't say I'm with you on that. Studying is going to get us nowhere. We need action at this point. All right. Is the Democratic bill, the House bill, going to get passed?
I think that they're breaking arms and buying people off at this point. I think they'll pass a bill. I think that the American people will be so irate that they will suffer terribly for it, because this doesn't have a chance of survival in the Senate. The Senate will be the place where the deliberative work is done, and that the American people's will be done, hopefully. But the issue today with the folks coming to Washington was incredibly important, because they said loudly and clearly, look, this is not the direction in which we want to go. This is not consistent with the principles of either health care or the American system of government.
But they may have had a large voice. It may have been a big draw, but unless their members of Congress who are Democrats are voting against the bill, this is going to happen.
Well, those members of Congress, those Democrat members of Congress, have to represent their constituents instead of their leadership. And that's a question that they have to answer, and I promise you they are struggling with it. You can see it in their eyes and in their body language all this week.
And we always talk about the blue dog Democrats, the ones who are more conservative, who tend to focus on the fiscal issues. Are you hearing any, are you peeling off any of those to your side? Or are you losing more of those?
Well, remember, this bill was supposed to be done in July, according to the Speaker's timetable. So those folks have already been peeled off. Now, the question is how many of them the Speaker is getting back into the fold. And they haven't got the numbers yet. If they had the numbers, they would have had the vote.
And so today, how many people showed up? Do you have any idea?
I'm a bad estimate of crowds, but tens of thousands. I've heard 25 to 50,000.
So I take it you're not giving up, at least at this point.
Oh, goodness, no. And whatever happens, we will not give up, because the American people don't want this. And so whether it's now, whether it's next month, whether it's early next year, or whether it's after the next election, we will make certain that the American people get a health system reform bill that respects patients and allows patients and families and doctors to make decisions.
Congressman Doctor, thank you.
Thank you.